My name's Harry and I'm a midwife. My friend Em has asked me to put together just a short video about being pregnant during this difficult time. As many of you will know, pregnant women have been asked to stay at home as much as possible over the last few weeks. We have every reason to believe that COVID-19 does not cause any extra problems to pregnant women than anybody else. So if you are pregnant and you don't have any underlying health factors, then COVID-19, should you contract it, will not necessarily cause you any more problems than anybody else. We do have women that have become really unwell with COVID-19, but they remain an extremely small percentage. The main reason that we're asking women to stay at home is because we know that during their pregnancy and when they go into labour, they will be spending considerable amount of time coming in and out of hospital, and for that reason we want to expose them as little as possible to this virus. What you may notice during your pregnancy as well is that part of your pregnancy package is changed slightly. So there will be times during your antenatal care routine that you'll be asked to have a virtual meeting with your midwife rather than an actual meeting. The timings of these appointments has been really carefully considered so that those times that we offer you a virtual appointment are times during your pregnancy where we believe it is not essential to have face-to-face actual contact with your midwife, but there are other valuable things that we can gauge from you in a phone conversation. Any blood tests and things like that would normally be taken can be shifted to another appointment, such as a scan appointment time or your next antenatal clinic appointment time. Of course, during your pregnancy, if there's anything that you're worried about, then you must call the line numbers that have been given to you already. And there will be a midwife on the other end of the phone that can talk you through any urgent problems that you have. What you will also notice during your pregnancy and forthcoming birth is that your partner, whether it be during an antenatal appointment or an ultrasound appointment or a labour assessment, will be invited to stay outside of the hospital. This is purely to reduce the traffic of human feet through the hospital, and in doing that we can keep people inside the hospital just that little bit safer, including you and your baby. The majority of hospitals are still allowing partners into the labour room or the birth centre room with you. And as far as we know, this is not going to change. It may change, and if it does, you will be told about it in plenty of time. Now, obviously, protocol will change from trust to trust and hospital to hospital, but generally speaking, the rules will be very similar across the board as we follow government guidelines. What you will also find is that once you have had your baby, within a few hours, your husband or wife or partner will be invited to leave the hospital. And at this point, we would recommend that partners don't come back to the hospital until it's time for you and your baby to go home. We know that this will be a difficult time, and we really ask that you bear with us and really understand that this is for the benefit of you and all the other women that are in the same position as you. Then we come to the time that you are having to spend at home. I really hope that you are able to enjoy your pregnancy, whether you are at the beginning of it or somewhere in the middle, or waiting in these last few long weeks to go into labour. In shutdown or lockdown, when you are in close proximity with other family members, times can get pretty fraught, and it's important that you are able to just put aside some time for yourself that's quiet, away from everybody else and on your own. And as a mother myself, I know how difficult that can be. So if you have little tiny tots around or teenagers around, you will know that finding time on your own can be difficult. But it's really important, especially during this time of confinement. If you are able, just generally day to day, to have a little bit of structure to your day, it will really help you get through these long days together as a family. Your partner will need time on his or her own, and your children, especially if they're older, will just need to cut themselves off from everybody sometimes, and that's okay. It's important that we can talk to each other about our feelings, but equally it's important just to be able to have time on our own. For some of you, you may have outside space. For others, it may be more difficult. But it's also really important when you're pregnant not to spend excessive time sitting on a sofa or in a chair. At the moment, it seems for many of us that there's not really much else to do. But actually, if you are able to, every few hours, get up, move around, walk up some stairs, bounce on a bouncy ball, just move your legs. It's really important because during pregnancy, other risks such as clots forming in our legs are slightly increased. So it's really important that you keep well hydrated and that you move around, just as we would suggest if you were on a long haul flight. Now, I know that some of you will find that this is a difficult time, and others of you will be just doing brilliantly, doing your yoga and breathing and just working through it. Some of you will have amazing supportive partners. Some of you may have partners that are finding this more difficult. But each of you must know that if you need any urgent care, or if you're worried about the situation that you're in domestically, that you can call the helpline for anything at all, including worries about your domestic situation. At this time, domestic situations can become fraught, and it's another really important aspect for us as healthcare professionals to recognise and understand, and we are there for you if you need anything at all. So I wish you all the best with your ongoing pregnancy and the first part of your time at home as a little family. And I hope that this short video has been helpful. Thank you.